Hello, and welcome to Psyched for Sanity. I am one of your hosts, Dr. Brindle Doss. I specialize in, I almost said attachment. Can you believe that?
I'm infiltrating your mind.
Get out
I'm
of
a
my
psychic,
head.
remember?
That's not what I specialize in.
Yeah.
I specialize in psychological assessment, trauma treatment, and geriatric, goodness gracious, great guacamole, geriatric psychology. I'm a licensed clinical psychologist. And when I was a teenager, I had a job at a theme park.
Okay.
And my job there was to dress up as Tweety Bird.
Okay.
And I loved it.
Okay, actually.
I loved it.
Okay. I don't understand that because I've actually done
Have you done costume charactering?
Job. I didn't. Okay, yes, but I hated it.
I loved it.
Why did you like being Tweety Bird? I'm pretty sure I know where you're talking about.
I'm sure you do too. Yeah, no, it was a great time. I loved it.
Was it not hot?
Well, you don't wear a lot of clothes under those costumes. Spoiler alert.
That's
it's not
weird.
great. It's not great.
And also, were the kids not evil?
So that's the sad part of the story. It doesn't end, it
doesn't end well for Tweety.
It didn't end well for Tweety Bird because that costume went over. So a lot of costumes, when you put them on, like for Halloween or whatever, your arms can freely move like, wah, wah, wah. With Tweety Bird, you were wearing a giant bell. And it went to here, to your arm, so you could do this. And then if one of those kids, the worst age was the 11-year-olds. They were especially vicious.
Yeah, it's because that's when middle school is starting, and
transitional
that's when
time.
all the hate. Yeah,
developmental psychology is always so meaningful to us.
Yes,
and they would come and hit the side of the bell, and I did get concussed twice.
No, you did not.
I did.
Are you serious?
I'm not gonna lie to you on a podcast.
It really explains a lot.
Hey,
it really, it really does.
Does it?
Yeah, I think so.
I didn't lose consciousness. I was mildly concussed.
Okay, well, I'm glad that you are not more weird than you are.
Thank you.
You're welcome.
I think. No, but I did that and I loved it because imagine going to a job. Think about this.
Okay.
And your character, the job that you're supposed to do. 90% of the people that you interact with are freaking psyched. Get it? Psyched for sanity.
No.
No. She says no.
No.
Psyched to see you. All these little kids were so excited to see Tweety Bird.
Okay, so I want to tell you my experience. I am Dr. Tara McKelvey Parker, a clinical psychologist that specializes in psychological assessment and treatment of complex trauma and childhood attachment wounds. And I was Chucky.
Wait.
I was Chucky at Chuck E. Cheese, and those kids were mean.
So let me tell you something. You said Chucky, I thought you meant the doll. I got really scared.
Well,
I got so scared.
That is scary. Why?
I was like, who would hire you to be a scary doll?
No, I think
so. You were Chuck E.
nice.
Cheese.
I would be a nice
You were
doll.
the mouse.
I was the mouse, and I walked around Chuck E. Cheese, and the kids kicked me.
I think they're meaner at Chuck E. Cheese than they are where
They're kind of feral.
Yeah.
Like a little feral. And I can say I've taken my kid to Chuck E. Cheese.
It's a rite of passage.
Many of times.
Sure.
But they're feral. They just run amok.
Yeah.
You know?
Yeah.
And so I guess they're just, it wasn't a pleasant experience.
I loved it. I was other characters. I was Dot, the girl from the Animaniacs. I was in a parade once.
That's cool.
I was the Tasmanian Devil.
Okay.
Scary part about that costume, once you are in it, because the head eye hooks, like an eye hook, all the way around to the body of it, you can't get out by yourself. Only someone from the outside of the costume could undo it.
That's intense. I don't remember how I got in and out of
So if you had to use the restroom, you were in trouble.
Okay.
So I was in a parade, like a holiday parade, as the Tasmanian Devil.
And did you have some accidents?
No, rude.
Get in and out of
No,
your
I am toilet trained.
costume?
Thank you so much. No, I did not. I'm just saying it was a fear of mine. I did cut back on the water that morning.
Okay.
I also played Yosemite Sam.
Okay.
And that costume, get this, was the craziest part. You know, he has a giant hat, right? Giant hat.
Yes.
The hat wasn't intact. There was a weird where it was almost like a flat cone, and then it was like a tortilla chip with a hole on it they put on separate.
Interesting. Okay.
Isn't that amazing?
Yeah.
Fun facts you never knew about.
Well, that does sound more fun, and it,
I had
it
a
really
great time. I had a blast.
makes me think about our experiences and why we are the way we are, and perhaps why I've needed long-term therapy is because I was physically abused by small children.
As dressed as a mouse.
Dressed as a mouse.
I cannot believe A, I didn't know that, and B, I feel like I'm going to make fun of you for so long about this. I am psyched
And
to tease you about
oh, Jesus.
Yep.
Okay. Well, I am
Psyched.
psyched that you had a positive experience, but
Yeah.
speaking of therapy,
Yeah, treatment.
and my long-term treatment because of the abuse that I endured from
Right.
being the mouse.
And other things, maybe.
We could just focus on the mouse.
I'm here for the mouse.
Focus on the mouse.
I'm very happy about the mouse.
Of course, yes. I think definitely my childhood was one of the reasons why I decided to be a therapist in particular. Like really,
yeah.
I started, I started out in psychology really wanting to do therapy. That is where
Interesting.
my heart is,
Yeah.
like really with families and children.
Same.
Now I love testing and it's such a big part of my practice, but therapy is still
Right.
probably about half of what I do. Half
Yeah.
testing, a psychological assessment, and half therapy. So
Yeah. I also, like, when I started, I knew that I wanted to be a psychologist, and I knew I loved kids, loved kids so much, and I was so just excited, just kids in general.
yeah.
And then the first place as a student in my master's program that I worked was at a child advocacy center.
Yeah.
And so this
That's
is
really hard.
Rudy's gonna put a disclaimer for those at home. If topics around abuse and neglect are problematic or challenging for you, you're gonna want to skip ahead and not watch or listen to this next part to protect your mental health, which we get and understand. So I fell in love with treatment similarly but differently to you. I think the way they trained you at this child advocacy center was before they put you in the room with a small person that had been through a really scary, bad, horrible thing, they had you watch forensic interviews with alleged victims. And for those of you that don't know, a forensic interview is a very specific type of interview that even Tara and myself are not trained to do because it's such a specific type of training. And forensic interviews are a type of interview where the interviewer, specifically trained, like I said, tries to collect data that can be admissible to court in the case of prosecuting people that abuse and hurt children, while also not further psychologically harming or damaging a child or adolescent. And so, as a young student doctor, I was sat in a room and watched some of these videos. And I remember there was one video that I can see today, and there's nothing scary in the video itself. It's a child talking about their experience, which can be traumatic and upsetting. And this little 6-year-old girl was talking about her experience of being sexually assaulted, and she talked about it in such an innocent way that I was moved to tears. But I was not like, I guess a lot of people, which is an understandable response, would be like, oh my God, this is so horrible, this is awful. There was definitely that part of me too, but I was so struck by the resilience and the power of this child, because she still was describing things in a very childlike, innocent, but also like almost unharmed way. And it was so powerful and so meaningful, and I really fell in love with working and doing trauma treatment for children. And that was my entry into therapy.
Yeah.
So
yeah.
So I know it's hard and difficult, but what I took away was the power and the resilience of that child, even going through this horrendous thing. To be able to talk about it, and to talk about it so plainly and clearly, it transformed me as a person and a professional. 100%.
So then, are those your specialties? Like trauma, working with kids?
Yeah, that's
in terms of therapy.
Well, ironically, it is. That's why we started the postdoc we've mentioned before, and that was that place, that facility was geared towards kids.
Yeah, definitely. And
children.
Yes, and my specialty in my PhD program was child, adolescent therapy, and family therapy. So I also love working with kids.
Yeah.
I did not start out at the Child Advocacy Center for therapy.
Definitely going through the ring of fire on that.
Really intense, although I was that child, right?
Yeah.
So I also have a heart and a passion for treating trauma. Um, I mean, I think in kids and adolescents, adults, and also it really informs the way that I do testing.
Same, still today.
Really thinking about diagnoses through a trauma-informed lens. But so what would you say then, like, what modalities do you like to use when you're treating kids, when you're working with trauma patients?
Right.
I also know that you really like to do parent coaching, which I
love to do that.
also love to do. I
Parent
think
management training, parent coaching.
goes hand in hand with
Huge.
working with kiddos for
Right.
sure.
So one of the main modalities that I started, so I definitely, when I finished the postdoc, I couldn't get a job doing therapy with children. That I wanted to work for a place or a company or a hospital, and I couldn't find a job. And so I ironically fell into doing geriatric therapy, and I loved that. And I found a lot of the tools and
that's
techniques.
another real specialty. I mean, you've had so much experience doing it.
I found like a lot of the things that you utilize with a child mirrored really, really well with an older adult.
Interesting. Yeah.
Because you can't sit a small child in a chair and say, tell me about your day or what's coming up for you this week. That's not going to work. And my experience and the modality that I utilize is play therapy, non-directive,
Okay.
Child-centered play therapy.
Yeah, same.
And that really, the whole theory behind that is that children communicate about their experience and about their symptoms and their feelings via play and how they play and what they don't play.
It's really true.
It's powerful stuff.
For non-directive play therapy specifically, it's really based on the fact that kids have inside of them what they need to heal. And really, with that kind of therapy, you're focusing on the relationship. You're building a container for a child to sort of like achieve potential on their own through their play. There's not really, necessarily a bunch of strategies that you're using or tools that you're teaching or skills that you're teaching, like sort of like a baseline non-directive.
It's not teaching a child. There's certain
it's
skills
really
you might use
following
in the play therapist, but you're not.
Yeah, you're
following
following.
for
You're
sure.
You're framing emotion. You're really like interpreting the play. You're helping them play through dynamics in their home that might be distressing.
Or any
Get a lot of it. Yeah, any experience. Transitions, divorce, all of it actually comes out in the way that a kid plays.
Right.
And so that's how they process their emotions around really tricky situations.
Absolutely.
And so I tend to be pretty non-directive too. I trained at the Center for Play Therapy at UNT. And I know you, though, with your play therapy.
I know, another way that I'm weird.
You kind of.
Go ahead. You're going to make fun. It's okay. Just get the making fun of over.
No, I'm not going to make fun of you. I was just going to say you kind of, you layer on, I think, some specific behavioral strategies.
Yes, I do.
I think you work with parents in maybe a bit of a behavior management, right?
Yeah. I think every training spot that I went throughout my school, and I think that you might echo this as well, when you're at that training spot and you're learning a new technique or a new modality or a new way to be with people on their mental health journey, you really like, at least for me, I'm like, oh my God, this is the whole world. This is amazing. I love behavioral therapy. And when I'm doing like non-direct, oh my God, this is the whole world. This is amazing. Let's do this forever. I really just get excited. And so how I've managed that experience as you grow as a professional and a student professional is I've learned to take and put in my basket the parts of those things that are really effective and helpful in working with families. So my private practice for 8 years was providing in-home play therapy and parent management training to children in foster care and the foster parents in foster care. And in that experience, a lot of children and even adults that go through traumatic experiences, one of the big areas that is affected is their sense of self, their sense of autonomy and authority over themselves. And they unfortunately get the message that they don't, the rules don't apply, like they don't have boundaries. The loss of boundaries that comes with trauma. And so one thing that I think, especially with children in foster care, they come from a variety, unfortunately, of challenging backgrounds. And what I found was really effective was definitely letting the play speak and letting the action come out. But I also really made sure I implemented specific strategies where I would bring literally a suitcase full of toys. Suitcase full of toys, roll up to a house, and I'd always remind the parent, don't worry, I'm not going to leave them here.
We don't need any more
We don't
toys.
exactly. No parent needs more. Everyone was
Every
like,
parent will understand.
every parent will understand that for sure. But I would go into the kid's bedroom or a space that was semi-private, open up the suitcase, and they would be able to go through whatever they wanted. But at the end, they had to help me clean up because it was important to learn.
Right, which is
boundaries.
not technically a
Non-directive.
child-centered, non-directive
Correct.
strategy, right?
Absolutely.
But I do think I'm similar. I mean, I think I tend to be pretty non-directive in play.
Right.
And at my heart, like in individual therapy, sort of a relational therapist.
I would say that, yeah.
But I
sure.
definitely I'm trained in lots of different cognitive behavioral therapy and dialectical behavioral therapy, and even some trauma-specific treatments. And
Right.
I love to speak internal family systems, right?
Love
like
some IFS.
parts.
Absolutely.
But a relational therapist really at its heart is believing that relationships really shape emotional health,
yes.
past and current. And so I think that really feeds into treating
Right.
attachment disorders, complex trauma. Really, I'm always trying to build a healthy, safe relationship with my patients and trying to give them a different corrective
yeah.
experience, different than what they got in their childhood. And so
Right.
I'm talk a lot about that.
Right.
I think in my therapy with people. And
Yeah, I think that a big thing like with that is just the understanding and helping them view themselves from a different perspective. And I think
That's
that's
really
safe.
hard.
That's safe. It's so hard.
Yeah.
But that's safe. But by creating that safe landing space in the therapeutic relationship, kind of going back to the container that you talked about for children, I think we try to do that.
Yeah,
Hopefully.
definitely. And I think one way that I try to do it is by trying to share authentically and vulnerably myself.
Right.
I think it's really important when you're
Absolutely.
treating trauma survivors in particular.
Right.
They are so full of shame and feeling not good enough. They have a low sense of self-worth and, a really unclear sense of self a lot of the time. So
Right.
I think relational therapy is all about building an actual relationship. And
Yeah.
so I like to share and I like talk back and forth and be as genuine as possible. And I always say, like, I'm one step ahead of my patients, I think, like in terms of feeling and
I
where
think
I'm
that
at.
authenticity is why you're such an effective clinician.
I think for you too.
Thanks.
Yeah.
We've talked about this, but in terms of talking about how important the relationship is to therapy, that is something that we are lockstep in for sure. I think about when you think about children, whether they're in foster care or not, any type of child experience where you're trying to help a kid manage, whether it's an emotion or anything, there is no, there's no management of a child's behavior without the relationship. If
Yeah.
you don't have a strong base, there's no effective management because they won't care
Yeah.
if you punish them.
Rules without relationship equals rebellion.
Love it. Say it again.
Rules without relationship equals rebellion.
Yeah, you should patent that. Can you
Okay.
TM that? How do we, Rudy? Do we just little? No, I'm just kidding.
It's true, though. It's really
It's
true.
so
Like the
true.
relationship and connection. I mean, when I talk about
Huge.
parent coaching, I'm all about skills and management and teaching things like that. It's very important.
Absolutely.
But for a lot of these challenging kids, if you're not connecting first, if you're not building a relationship,
Right.
if you're not sort of trying to understand their symptoms as a bid for connection
Yes.
or to communicate a desire or a need or
Absolutely.
a feeling.
You know what I used to tell parents? They would be talking about, because I'd always check in with the parents, like, oh, Billy is da 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 da, and I said, I'd very kindly say, and I probably wouldn't say it the first session. I said, Billy's not a Disney villain. You can feel like Billy is a Disney villain, but he is not. He's just trying to do whatever he can to survive this moment. A lot of the times, especially with trauma, and especially in my work with foster kids, what worked to keep them somewhat safe or somewhat feeling okay or better in a maladaptive environment, that behavior was adaptive in that environment. But when you take them to a safe, secure, consistent environment, that behavior becomes maladaptive. It's not safe or helpful to grab the food as soon as it's, take it out of the fridge in an adaptive environment where there is enough food to go around. But in a maladaptive environment, if you don't do that, you're not going to get food. It's adaptive.
Oh,
So
yeah,
really
absolutely.
helping that foster parent understand
Yes. And
is
then
crucial.
in individual therapy, because I do see a lot of adults. I would say, like,
Right.
in terms of kiddos, I maybe have a couple on my schedule right now,
Right.
maybe a couple of parents.
Mm-hmm.
Um, but I have probably a majority of these
Right.
adult survivors of childhood trauma.
Right.
And that is really that's what complex PTSD is,
Mm.
which is like a huge population that I see in my practice. It's kind
Yeah.
of,
That's a whole separate podcast, right?
yep, complex
Massive.
PTSD. And so it's interesting to look. It's interesting to look at it, what it looks like in childhood and play, and then what it looks like in adulthood. And a
Mm-hmm.
lot of the same maladaptive behaviors
Right.
in childhood that develop from having a trauma history
Right.
actually kind of are very similar.
I just realized something.
Yeah.
I don't know if I defined adaptive or maladaptive. Could you
Yeah.
help me with that?
Like adaptive environment versus maladaptive
I realize
environment.
sometimes we use lingo that not everyone at home listening or watching might understand. So I want to make sure that's clear to them.
Yeah, so it's some kind of adversity. A maladaptive environment, I think, when I think about that, is some kind of adversity that a child is experiencing that causes chronic and prolonged stress.
Okay.
Okay, so adversity could be trauma.
Right.
What we think about as trauma is what we capital T trauma.
Mm-hmm.
It's physical abuse, sexual abuse,
Emotional abuse.
emotional abuse,
or neglect.
Yeah, neglect. I would tend to put that maybe a little bit more in like the little t trauma area. Okay, so like,
I haven't thought about that.
okay,
Yeah.
yeah. I mean, I think a neglect is actually one of the main criteria and enough on its own to cause
Oh my gosh,
childhood
that's
PTSD
exactly-
and like
yes.
complex PTSD. A parent who is just emotionally not available for some kind of reason because they have their own mental health issues or addiction,
For like a variety of presentations that might occur.
variety of presentations.
Absolutely.
So it could also be a loss, like a death. That's huge.
Massive.
Or a significant abandonment that isn't a physical abandonment, but emotional one. When I was 6, my mom sent me and my sister away to live with my great grandmother after a traumatic incident, and it
That
was
was a
for
loss.
6 weeks.
That's a big deal.
I mean, I've literally had to do individual therapy, like specific trauma focused therapy on this abandonment. I had
Right.
no idea why I was sent away. I
Right,
thought it was
yeah.
my fault,
Right.
right? So
Because no one explained it to you.
right. So it was
Yeah.
like a physical and emotional abandonment. Like no one helped me make sense of what
Right.
happened to me. So those kinds of things, what they do is they chronically stress the nervous system
Yes.
of a young child.
Yes.
Okay, so they develop hypervigilance. Their super ego, which is supposed to be healthy, right? There's an ego, which is like your sense of self.
Mm-hmm.
There's your id. This is Freudian, impulsive sort of part of you, and then there's the super ego
Right.
that's sort of supposed to be your conscious. It tells you what's good and what's bad and what's right and
Sure.
what's wrong. But when you experience trauma or neglect, like that super ego, it's like on steroids, and it beats you up and tells you you're terrible all the
And
time.
that's connected to that nervous system.
It's connected to the nervous system. You're
Absolutely.
hypervigilant, think something bad's going to happen, but also you're terrible because nobody took care of you. And that's
Yeah.
just sort of that's how,
Right.
complex trauma happens.
I always
and these
tell people when I
maladaptive
describe
systems.
it to patients, because a lot of patients, when they come to you, they might know their story and their experience, but they don't understand what's happening for them.
Yes, exactly.
Just this last
Yeah.
week, I explained to a woman well past, like towards the later years of life, that trauma impacts and affects your sense of self, your view of who you are. I was a good girl and now I'm a bad girl, or I'm a bad boy. Your view of other people, meaning that people are mostly safe or mostly okay, and now people are not to be trusted. And then your view of the world, which just means the world is generally a safe place, and then now the world is not a safe place.
Yes.
So those areas are
Yes.
so impacted, and it really changes. Unfortunately, it can.
Right. And then the
Impact that
neglect
belief.
on top of that, can
Neglect.
impact. It's a whole other, kind
Right.
of sort of traumatic experience that impacts how you view yourself.
I find
world.
in my work and my experience that neglect is, and I don't know if you would, I would like to hear your opinion on this. If you have an abusive input, then maybe this is a bit controversial, I don't know. But if you have an abusive input, I think that trajectory of treatment and recovery is, and none of, I want to be really clear, none of this is smooth or easy or fun, obviously. But I think the trajectory of recovery from an input type of abuse versus an absence, which is neglect, is much, much harder, to treat. Because I think humans, if there's no input whatsoever, do you know what I'm trying to say?
You're talking about like an actual overt abuse?
So, like, let's say talk about, really extreme situations where children have been, like, locked in places, things like that. Real neglect, like lack of input into the environment.
Oh, I see what you're saying.
Neglect and when I think about neglect, I think
Okay.
of lack of input in the environment, whether they're not being touched, not being held, they're not being fed. They're like really specific things.
Well, and I think it definitely exists on a spectrum for sure.
All of it does.
Yeah.
But I think when you don't have any input whatsoever,
Well, yeah.
it's worse
that would
than
be
having
very
abusive input.
Well, it's so we could go into talking
Forever.
about
Forever.
attachment disorders and
Forever.
orphanages and all that, which I get a lot of those testing cases, but
Right.
maybe we should pause here. It's pretty it's a heavy
It's
topic.
It's important to acknowledge the heaviness. I think
Yeah.
even for professionals like us that do this day in and day out, this is an important, difficult topic.
Yeah, and I think we'll talk more about it because
Absolutely.
we obviously both assess and treat
We do.
trauma. So
And we care
yeah.
about it.
Yeah, I think so.
Yeah, it's important to us professionally for sure.
So, if anything about this episode resonated with you, definitely leave some feedback in the comment section. We'd love to hear from you.
Absolutely. And, we want to encourage our viewers and our listeners that if you have been impacted by trauma or abuse, reach out and find a mental health care provider. Support exists. Your story is important. You matter. You have value and worth. And you deserve to feel okay. That's important. I want them to hear from us too. After this kind of heavy topic, because we love therapy and we love joining someone on their mental health journey, what do you need today?
I think I feel really sad
Okay.
actually hearing about all of this.
Yeah.
Yeah. Speaking of
Hard things are sad.
Yeah. I kind of feel like I need like a cozy blanket.
So you
like
just need
some-
some support and containment.
I think I need some like tactile, sort of fuzzy warmth, comfort. Like, yeah, would feel good.
I should have brought you a stuffed animal.
I need to bring
Like I have some large stuffed animals.
My child has like probably 500. Okay, so what about you?
I think what I need is today is just to remind myself, and I'll remind everyone that's listening that of that light that I found many, many years ago that exists. That even in the face of horrible things, you can feel power and you can feel comfort again. And I think I just need to remember that. I think I also feel that sadness and that heaviness.
Yeah.
And I think I just need to remind myself, and I guess this is maybe a reminder to myself, that the work we do and the work that mental health professionals do is important.
Yeah, very
You
true.
know?
Very
Yeah.
true.
Absolutely. This podcast is intended for informational and educational purposes only and is not a substitute for therapy, diagnosis, or any kind of professional mental health treatment. We hope that we can share with you our experience authentically and genuinely, and we hope that occasionally we'll make you laugh. Maybe you can relate to our quest and how we're psyched for sanity. The content we share is our personal opinions and insights. They are not clinical insights to anyone, and they don't represent or reflect any entity that we work and or have worked for in the past. But if listening to this podcast has made you think, we really encourage you to seek out a mental health professional in your area.